Hello, and welcome to another episode of Thriving Thursdays with me, your host, Dr. D. It is such a pleasure to be back again, as always. And if you are new here, let me introduce myself. I am Dr. Dewan Carpenter, better known as Dr. D, and I am a board certified physical medicine and rehabilitation physician specializing in lifestyle medicine. And what does that mean? That means that I help busy people to refocus on their well being using lifestyle choices in order to step out of chaos and thrive. And so before we get into our topic for today, I want you to take a minute, make sure that you have subscribed to my channel, make sure that you like and share this video so that other people will also be able to find it. All right, so today our topic is how do I drink more water if it tastes nasty, if it's disgusting, if I just simply do not like it? I get this question I get this question a lot because, of course, in talking with patients, I always say to them or ask them, how much water are you drinking every day? Depending on what they are coming in for, what their symptoms are, it's important that I know how much water that they are actually getting in their diet every day. You would be surprised, maybe you are one of them. Many people think that they are getting enough water. And when I tell them that is definitely not enough, then they are always surprised. So maybe you have always heard that um, you need 8 glasses of water. Many of you probably have heard that. And for me, it's always, well, what do we define as a glass, right? In my house, I may have the small glasses. So is that 8 of the small glasses, 8 of the big glasses? It's always hard. So as a rule of thumb, I always go by the ounces because that doesn't change no matter what glass or container or water bottle that you may be using. And I use as a guideline half of your body weight in ounces. Okay. So if you are, just for simple math, if you are 100 pounds, that means your daily goal, at least at a minimum, is going to be 50 ounces of water. So think about ounces. If you have one of those 20-ounce bottles of soda, right? A regular bottle of soda that you get from the vending machine, the plastic bottles is going to be 20 ounces. So, roughly two and a half of those, right? If you're 100 pounds. Now, the lifestyle American Academy of Lifestyle Medicine actually goes by cups. So that may be a little bit easier for you to manage because, again, if you have a kitchen in your home that has measuring cups, you have a cup of some sort. So not just what you get out of the cupboard, a measuring utensil, which is a cup. And actually the amount varies depending on if you are a man or if you are a woman. So, in total, you want your daily fluid intake for women to be 11 and a half cups, or if you are a man, 15.5. So, 15 and a half cups of water. Now, that can be plain water, or that can be water from your food and beverages. So, again, that can be a little bit hard to keep track of if you're talking about food and beverages, but that is the overall daily recommendation. Okay, we're going to talk about some ways to do that if you don't like water, but I always feel like it's important to talk about why do we need to do this? Why do we care? Why should I make sure that I have a certain amount of water in my body every day? Well, the first thing is your body is made up of majority water, okay? So, keeping your cells, because our body organs and parts and skin and all of that is made of cells. and each cell has fluid in it made up of water. Again, for simplicity, it's more than just water and whatever else, but you need water to keep the cells to be able to function and keep them plump, right? So you don't want it to be dehydrated because then you are going to experience a lot of functions that are not being able to process when you don't have the appropriate amount of water. And that's the first thing. Your kidneys also function based on how much fluid that they're seeing. So your kidneys act as the filtration, one of the filtration systems that you have in your body. So all of the water or liquids that you take into your body, your kidneys, because you got two of them, your kidneys are operating to filter that. So it's taking water out, it's putting water in, all those types of things. And what is left over, what you see when you go to the restroom and you have to urinate. Okay. So, another way, if you are not really good with keeping track of how many cups or ounces and things like that, the cheat code to have you had enough water today is looking at the color of your urine, okay? Your pee. Is it dark yellow? Is it light yellow? Is it cola colored? Believe it or not, that is a real thing. So, a good rule of thumb is that your pee, when you look in the toilet, you should look to make sure that there's nothing else in there, should be like lemonade. So a very light yellow, maybe. But if it's anything darker than that, you definitely need to increase your water intake. Again, it's very important because your body runs off of water. It's majority of water. And so in order for you to be able to do all of the different processes that need to go on in a day, you need to have an adequate amount of fluid in your body. Now, if you see that your urine is cola colored, like looking like Coca-Cola, Dr. Pepper, that is definitely not normal and definitely the sign of a problem. And I would recommend that you consult your doctor immediately because that can be a sign of internal kidney damage. And what you don't want is to have damage that is irreversible because that can lead to dialysis, which is basically using a machine now to filter your blood, and because your kidneys now no longer function. Okay. So that is why it is important. And that's the cheat code. Now, what if you don't like water? You don't like the taste of water at all. Okay. So I gave you some numbers. I'll give you another portion to say aim for, again, based on recommendations, 4 to 6 cups of just plain water. Okay. The rest of it should be from, other beverages and your food intake because we do have liquids in our food and things like that. If you don't like the taste of water, some really good recommendations, and these also help with other aspects of your overall health and wellness, happen to be if you take fruit and put it in your water. So you may have heard fruit infused water. I know frequently if you go on vacation, especially to a warm climate, the hotels often will have fruit infused water, and that can range from strawberries to oranges to just lemons, limes, whatever it is. For the most part, whatever fruit that you like, you can infuse it into your water, and I would highly recommend that. It gives you a little bit of flavor that is not just plain water if you don't like plain water, but it also, again, gives you some of the other benefits of the fruit at the same time. So I love when I can kill two birds with one stone, accomplish multiple things just by doing one thing. So that is one of those ways. If you're not much on fruit infused water, maybe you don't like fruit per se. I do know some people that really don't like fruit. And maybe that's not going to work for you. There are flavors that you can get in the grocery store, and I'm not talking about Crystal Light because Crystal Light really, in terms of the ingredients, isn't the best option. But certainly, I tell people if the only thing that you like is Crystal Light and that gets you to drinking water, we're going to go with that until we can again try some other things that may help you to switch to a different habit with regards to your water intake. But we're going to take it if Crystal Light is what you like. But the recommendation is if you're going to put any type of flavoring in your water, the recommendation is to have it be something that does not contain sugar. All right. So, sugar, that's a big kind of buzzword, but you should know that sugar hides in our ingredient list. Okay. So, it may not say sugar directly, it may say cellulose, it may say sorbitol, it may say, oh, I'm blanking on all the other ones, but if it has OSE in it, more than likely it is a sugar that is hiding as a non sugar. Okay. So one of the brands that I like and is Mio. They have no sugar added flavors and they come in a very wide variety. So they have sweet tea, they have lemonade, they have cola flavored, they have berry. I mean, they have a whole plethora of flavors that you can try. And that again can help you to meet your daily water intake and get something that you like, that tastes good, that you will continue to drink. So there's that. You also can consider doing herbal tea. So if you do herbal tea, you definitely want to try to do the make sure that it is non caffeinated because caffeine actually acts as a diuretic. So that means it acts as something that in your body will make you dump more water than retain. So you're kind of chasing your tail, if you will, if you do something like a caffeinated tea as part of your daily. Certainly, if you like caffeinated tea, keep it to a minimum. But in terms of your daily requirement, it may kind of cancel itself out just due to the caffeine. But herbal tea is great. Again, you want to minimize sugar or no sugar. I know for some people, they have to have something in it, but you want to again, go more for natural sources. If I need a little sweetener, I will use stevia because I don't need a lot of it. I can do just one drop, like if I'm using the liquid stevia, and it gives that little bit of sweetness, that kind of punch of flavor, but not a whole lot of extra. That's a good one. Um, Using your local honey, again, if you use a minimum amount of it, can be helpful as well, especially if you are someone who suffers from allergies. So, getting local honey in your region can also help combat your allergies. And what other things? Monk fruit sweeteners. So you want to go for things that are a little bit more on the natural side. Obviously, if it was made, it's not natural per se, but you want to go lean towards the natural side as opposed to the granulated cane sugar and things like that, because they have been so highly processed and highly refined that, again, you kind of minimize some of the benefits that you would ordinarily get. But those are just some tips and tricks for that. Maybe tea is not your thing. You also have the option of sparkling water, which again, I like. If I really want something that has flavor, I'll get sparkling water. Usually it is literally just the flavor of whatever, fruit or beverage or what have you, and sparkling water. Literally, that's it. You can make your own as well. So you can I forget what those little things are, but they put the little sparkle the carbonation into the water. They have those little things that you can get at home and make your own as well. But I'll use that. My kids drink the sparkling water. Sometimes they add the sweetener in it, but I try to get them to at least taste it without the sweetener. And I know one of the flavors we got recently, they were like, "Oh, this actually tastes good without the sweetener." I'm like, "I've been trying to say that." So again, just try some things. You may be surprised. Maybe some flavors don't require you to uh, add sugar, and you can drink it better, or so that is an option. Sparkling water, again, lots of brands and flavors. Always look at the back of the ingredients to make sure that they did not add sugars, because there are some that do. Again, offhand, I cannot think of the names, but I know that they're in the water aisles in the grocery store, and they have really great flavors. I know even myself, I grabbed one. I think it was pina colada flavor. It was so tasty. So tasty. And I'm like, this tastes way too good to just be sparkling water with a little bit of pineapple and coconut flavor. I looked on the back of it, packed with one of those sugars. And I was like, oh, no wonder it tastes so good. So just be mindful of that, because even the sparkling water sometimes will have some sugars hidden in there. And those are pretty much the tips and tricks for what you can do for drinking water if you really don't like the taste of water. I mean, worst case scenario, it is you just suck it up and drink it, um because it is necessary. You don't want to go where you don't drink water at all, which I certainly have had patients that the only things that they will drink is diet cola or diet soda or whatever it is. Over time, those things will definitely catch up to you in terms of your body being able to continue to process the way that it needs to. And again, the biggest area that you see issues with that comes with your kidneys. So your kidneys help regulate your urine production, but also helps to regulate your blood pressure. So if you're having issues with blood pressure and things like that, and you are not doing a lot of water and doing more sodas and sugary drinks and things like that, that may be a place to take a look at as well. All right. So, how do we make sure that we make this easy? Because here's my thing: I want to live well, I want to be well, but I also don't want wellness to be a whole nother job. And so, for myself and for many of you out there, you're busy, you have lots of things that you are doing. So we want to make it simple. So, one good way to make sure that you are keeping up with your water intake is to have a water bottle. And of course, I'm doing this video and I don't have my water bottle right here with me. So, but a water bottle is a good way, a refillable water bottle is a great way to keep up with that. So most of them tell you when you purchase them how many ounces, and you can figure out, okay, how many of these do I need to drink? If you don't want to do the ounces, you can just Google converter, how many cups would this be? And you can figure out how many you need. Now, there are some water bottles out there that give you the cheat code as well. On the outside of the water bottle, it says how many ounces, and it tells you once you get down to a certain up, you need to refill. Okay. So, or it has ounces and cups, some of them. So that's another way that, again, you want to make it easy, simple, where you don't really have to think about it. Up, here's my water bottle. This is what I'm going to use for my daily water intake. I just need to drink 2 of these. So that matters as well. And also, I forgot to mention, it matters if you like your water room temperature or cold, because that also has an impact on how you drink the water. So, uh, personal story, I love ice cold water, But I noticed when I was really starting to pay attention to how much water I was drinking and making sure that I drank enough water, the ice cold water, for some reason, I just wasn't able to really get all of the water that I needed in the course of a day. So I switched to chilled water that wasn't ice cold. And I noticed that I was able to drink more. And if I had a water bottle that had a straw, so I could be doing something else, sipping on the water all at the same time. For me, that made it easy. So I didn't really have to think about it. Again, for you, it may be something different. What's important is that you figure out what works for you and you make sure that you get the water that you need in a day. Something else that helps is they have reminders. So if you have a smartphone, there are water drinking timers and reminders and things like that. Okay. So that can help you as well. Now, for me, I recognize that I would just ignore the little timer and keep doing whatever it was that I was doing and not drink my water. So, again, whatever works for you, but these are some options. And certainly, you want to make sure that throughout the course of your day, every day, that you are getting foods that also are hydrating. So, many of us know that watermelon, the hint is water in the name, is majority water. So that is a very hydrating fruit. But cucumbers are as well. Celery also is a hydrating vegetable that you can use. And so, again, two birds with one stone. You can get your hydration with something that is tasty, and you kind of trick your brain that I'm not drinking water, I'm eating a fruit or a vegetable that I like, but I'm getting my hydration. So that is another tip for you. All right. I think there was one other thing. Oh, yes. So the last kind of caveat to this is if you are exercising, if you are out in the heat, if you are pregnant, if you are breastfeeding, your water intake is going to need to change. Okay, I'm going to say that again. If you are exercising, if you live or are out in the heat, if you are pregnant, if you are breastfeeding, your water intake is going to change. That means it should increase and not decrease. Okay, one last story, personal story. So I was pregnant with twins. And after I had them, I kind of continued my routine, so to speak. Actually, it was probably a worse routine, but I was breastfeeding and suddenly started developing a really bad headache. As a matter of fact, it woke me up in the middle of the night, probably 2, 3 o'clock in the morning. Excruciating headache, worst headache I had ever experienced in my life. And as a physician, anything or anytime somebody says worst headache of my life is kind of a trigger word or a trigger phrase for bleeding in the brain. So I'm kind of freaking out because I wake up with this headache. Again, most people don't have headaches that wake them up out of a dead sleep either. And I'm kind of panicked, like, oh my gosh, something's happening. I'm bleeding on my brain. I gotta get checked out immediately. Fortunately, praise God, it was not bleeding on my brain. However, I was severely dehydrated because I had not increased my water intake. I hadn't increased my water intake for one baby, let alone two babies that I'm breastfeeding. Okay. So I was so severely dehydrated that it triggered migraines. So again, you want to be mindful and stay up on your water intake, and make sure that you know what is needed for you. Okay. The other caveat is there are some people, based on your medical history, that cannot do the recommended water intake. So 11 and a half cups if you're a woman, or 15 and a half cups if you're a man, may not be good for you depending on your medical history. So let me say, if you are watching this, This is for information purposes only. This is not specific instruction. This is not specific treatment. I'm not specifically telling you what to do. I am giving you some education and guidelines that if you need to make some changes, I want you to discuss with your doctor. Because while I am a physician, I am not your physician, and things may be different for your specific medical history and your specific body requirements. Okay. So that is the last thing. But overall, we all need water. So if you don't like the taste of water, there are lots of options out there where you can still get the water intake that you need without making yourself suffer with something that doesn't taste good for you. Okay. All right. I think that is it for today. And certainly, I appreciate you for tuning in. Just a friendly reminder, if you caught this on the tail end, I want you to make sure that you subscribe, hit that bell button, like, and share this video so that other people know that. So that people know that I'm out here and they can get this information as well. So sharing is caring. Don't be stingy. Okay. All right. I really appreciate you for tuning in. And if you happen to be in the Tampa area and you are looking for a wellness physician for weight loss or weight management, certainly check me out. I will make sure to put my information in the bio section of the video so that you can contact me as well. And I hope that this was helpful. And I look forward to our next time. Next Thursday, Thriving Thursdays will continue. As always, it is a pleasure, and I hope that you continue to be well. Until the next time, see you guys.